Older women in Singapore may be suffering in silence with bladder control issues. More than half screened in local studies were found to be incontinent. When offered treatment, only 1 in 5 took it up. Now, for more on why women shy away from treatment, we speak now with Dr. Ong Ai, the family physician at Kallang Polyclinic and advisor on women's health at NHG Polyclinics. Dr. Ong, thank you for coming and speaking on this topic. You know, when people think of incontinence, they think of a leaky bladder when you cough or when you laugh, but it can be quite debilitating for women, can it?
Yes, so it is not a serious condition, but it is inconvenience, which is probably why a lot of the women doesn't come forward for treatment. So some of them don't come for treatment because they feel that it is embarrassing. Sometimes they feel that maybe treatment is not available, or some of them are worried that the only treatment available is surgery, which is why they don't come forward for treatment. But the truth is, treatment, especially in the early phase, is very useful. It can improve their quality of life.
Yeah, I mean, that's good to hear because there are a lot of misconceptions, right, when it comes to this. And you've just mentioned a few, especially when it comes to female incontinence. So talk to us a bit about the causes, for one, and also how female incontinence differs from male incontinence.
Okay, so there are many types of urinary incontinence. For example, in female, the most common one is stress and urge incontinence. So stress, as per what you mentioned, so when they sneeze, when they cough, when they do some exercise, they may leak urine.
So stress is not anxiety, but it's the pressure.
Yes.
Okay.
And then urge incontinence is when you suddenly feel this urge to pass urine, and then you leak before you reach the toilet. So in female, the risk factors are generally things like menopause, childbirth, pregnancy itself, and aging. So whereas in male, more commonly they experience overflow incontinence and urge incontinence. So overflow is usually due to a blockage of the bladder outlet. So there's a buildup of the urine and then it just leak continuously. So these two conditions in men are more commonly due to prostate enlargement.
Okay, so very clear difference there. I'm curious because there was this survey done of screening, and when half the women that were screened were found to have incontinence. Now that's a big catchment, don't you think? Is that significant that it's so prevalent in Singaporean older women?
It is. So in National Healthcare Group Polyclinic, we identify that this is a very important issue. But unfortunately, a lot of time is underdiagnosed and undertreated. Yeah, which is why we started this pilot program at Kallang Polyclinic May 2024. So what we are hoping to do is to bring the care for women with urinary incontinence closer to home. So what we do is first, when women come in for cervical cancer screening, so the nurses at the same time will screen them for urinary incontinence issue. So by proactively asking and screening for the symptom, we are opening up this channel for women to come forward and seek help.
Okay, and making it perhaps more mainstream and more acceptable in that sense. You know, so the thing is, the way you talk about it, it seems very optimistic, but still, the older women, 1 in 5 in fact, when they are offered treatment, they say, no, you know, why is that the case?
So in studies, we know that the most common reason is embarrassment. We know that it is a very deeply personal, somewhat sensitive, and sometimes embarrassed issue to talk about.
Right.
Yeah, so as per the other barriers that I mentioned earlier.
Yeah, but if you're already diagnosed with it, if it's already uncovered, why not just take the treatment? What's the treatment entail?
So I guess a lot of time is lack of awareness. So sometimes women are not aware that treatment is available, or they feel that treatment may not help.
Give me an example of the treatment.
Okay. So for example, for the patients who come in with urinary incontinence, first we need to assess. So exactly what type of incontinence it is, what are the causes, what are the risk factors, because the treatment is different. So, but I can give you some examples. So it can range from non-pharmacological treatment to medication and even surgery. So for example, what our nurses can do, so they actually train to deliver this non-pharmacological management. So they can teach patients things like pelvic floor exercise. They can teach them on bladder retraining. They can also advise them on lifestyle modification. So for example, patients who are overweight, they can talk about weight management. They can advise them on food and drinks that can irritate the bladder, so to reduce that. And they can also educate them on suitable absorbent products.
And then I guess in more serious cases, then surgery will
Yes.
be brought in.
But
Okay.
in between,
Yeah.
there's also medication.
Ah,
Yeah.
so there are many steps and many levels that they can take, to deal with this issue. As we were talking in the break, incontinence is just really one of many female-specific issues, particularly when it comes to women in middle-aged women that are so ignored, like menopause and things. What do you feel needs to change?
So I guess first of all is the increase in awareness. So what we are hoping to achieve by this pilot program is by increasing awareness in the community,
Right.
and by sharing our experience, we are hoping to inspire conversation and support in the healthcare system to help to support this group of female with urinary incontinence better.
Right, so that's the next step. Might it actually become a fixture on this suite of medical treatments that are offered to women automatically, or does it still have to be requested?
So ideally, so eventually, hopefully, it's just a mainstream service in future.
Yeah.
But of course, after a while, when there is more awareness about the topic, then hopefully women naturally will just come forward and seek help when they have the symptoms.
Okay, well, good luck, and I hope that we get a lot of traction in this area in the coming future. Thanks for coming in,
Thank you.
speaking with us there. I've been speaking with Dr. Ong Ai Lee, women's health expert from NHG Polyclinics.